Hello, welcome to our presentation on chronic venous insufficiency. Let's get started. I'm going to introduce our team really quick. So you'll be learning about CVI from Wendy, Danielle, Brianne, and Dulcinea today. Here is just a quick breakdown on what will be covered in this presentation. I know I like to have an overview or summary for my notes, so I hope this helps you. Just a quick introduction you can see here about venous insufficiency. To put it simple, in CVI, venous blood escapes from its normal antegrade path of flow and it refluxes backward down the veins into an already congested leg, causing it to pull and cause all sorts of discolorations. But we'll learn more about this as we move along. What is chronic venous insufficiency?
Hi, today we're talking about chronic venous insufficiency, and this is a disease that affects mainly the lower extremities of the body, the deep veins, as well as the superficial veins. And as we've learned in chapter 21, in the section that says the aging cardiovascular system, there is effects that happens because of our age that happens even with our veins. So in the case of chronic venous insufficiency, it's either the valves that are incompetent and they are not allowing full closure or full forward moving of the blood, or there's an obstruction that's causing the blood to not go back to the heart. And also it can be an issue with the muscle pumps, commonly in the calf area. So this blood basically is trying to get back to the heart, but because of these either incompetent valves or obstruction, the blood is going right back down to the feet and is causing that swelling. A common condition, subcondition that we know and we've seen commonly is varicose veins. And what's kind of scary about this condition is the only sign that could show up with the varicose veins are the varicose veins. So although this is a sign of something deeper and more serious, sometimes they don't have pain, sometimes they don't feel the full effects. But there is an issue with chronic venous insufficiency that this can turn into a bad ulcer, and this is because of the poor circulation that's being affected in the lower extremities because of the abnormalities in either the valves or, as I mentioned earlier, the muscle pumps, or there's a blockage.
Question 1. A patient with chronic venous insufficiency asks the nurse what has caused his condition. The nurse will require further teaching if she states that A. The cause of chronic venous insufficiency is due to a condition involving inelastic arteries of the lower limbs. B. Chronic venous insufficiency is a disease that involves valves in the veins that are dysfunctional and cause blood flow to backflow and pull in the legs instead of move up to the heart. C. Chronic venous insufficiency is a disease that involves dysfunctional muscle pumps, generally in the lower extremities. D. Chronic venous insufficiency is common in young children and adolescents. Answer rationale. The correct answer is A. The cause of chronic venous insufficiency is due to a condition involving inelastic arteries of the lower limbs, meaning it involves an incompetent venous valve and muscle pumps located usually in the lower limbs and commonly seen in elderly people because of the effects that age has on our body. Signs and symptoms.
Signs and symptoms of chronic venous insufficiency are swelling in the legs and ankles, which usually occurs after them standing for a long period of time. They can have a tight feeling in the calves or itchy and painful legs, kind of like an achiness feeling. When walking, they can experience a lot of pain that usually only stops once they're at rest. They can have discoloration in the skin that's usually more prominent at the medial of the ankle, but it can expand to the foot and the lower legs. They can also have varicose veins, which is also called spider veins. They can produce leg ulcers. It can be multiple or it can only be one, and it's actually extremely painful for them. They can have an uncomfortable feeling in the legs, and then they can also experience the feeling to have to always move their legs, which is also known as restless leg syndrome. They can experience leg cramps, muscle spasms, such as Charlie horses, and then they can also have numbness and tingling in their legs, in their ankles, and in their feet.
Question 2. A nurse is assigned to a patient with chronic venous insufficiency. What are some objective findings she is expected to observe? A. Numbness and tingling. B. Leg ulcers that are not improving. C. A tight feeling in the calves. Or D. Low respiration count. Answer and rationale. The correct answer is B. This is the objective sign or symptom. With answers A and C, they're both subjective, and answer D is not a sign or symptom of CVI. Diagnostic testing.
A primary diagnostic test for venous insufficiency is the Doppler ultrasound. It transmits sound waves to produce images of the blood vessels. This specifically examines the blood flow in the major arteries and veins in the legs and arms. It determines if blood is flowing the opposite direction instead of flowing back to the heart like it should be. This ultrasound is non-invasive and it takes about 20 to 30 minutes. There's also another diagnostic test called MR venogram, and it's another MRI scan that uses radio waves to provide images of the veins, except a contrast is injected into your IV to highlight the blockages or valve problems in patients who are allergic to contrast dye or iodine or shellfish, or who have conditions such as asthma, anemia, hypotension, and sickle cell disease should notify the radiologist or tech. This scan can take 60 minutes or longer. And there's also another diagnostic test called CT venogram, and this uses a series of x-rays to detect blood flow and blood clots. A contrast dye is also injected into your IV. Contraindications for using contrast agents include history of reactions to contrast, pregnancy, radioactive iodine treatment for thyroid disease, renal disease, or if you're using metformin. This test usually takes about 45 minutes or longer.
Question 3. A patient comes in showing signs of edema in lower extremities, discoloration near medial of ankle, and a leg ulcer. Which diagnostic test would be best to determine if the patient has CVI? A. Electrocardiogram. B. X-ray. C. Doppler ultrasound. Or D. Biopsy. Answer and rationale. So the correct answer is C. Doppler ultrasound. This is the best diagnostic testing method to diagnose CVI. With the rest of the answer choices, they're not generally the best diagnostic testing used. Like an electrocardiogram, yes, it is used for cardiologic related conditions, but not for CVI diagnosis. An X-ray, it's not a clear enough image of a vein, and a biopsy is not a method used to diagnose venous or cardiologic diseases. Medications.
Hi, this is Candy. I'll be talking about the medications today. So researching for this, I discovered that there's no oral medication yet that has been proven useful for the treatment of CVI. So essentially, treatment is aimed to correcting the underlying abnormalities. Think like with COVID, there's no actual COVID medication, but we will treat your fever and we will treat your cough and stuff like that. So we start off with the pentophylline drug. It's a prescription drug most commonly used because it helps improve the certain blood flow problem in the legs caused by CVI, and it helps reduce the leg pain caused by the poor circulation, as well as anticoagulation therapy, or as we know it as blood thinning medications. They are recommended for the people that have recurring problems with their veins in their legs as well. And on top of that, aspirin can also help, and if poor circulation leads to these ulcers, aspirin helps with the treatment of the ulcers as well. In general, adding aspirin therapy to compression bandages is recommended in the treatment of venous ulcers as long as there's no contradictions to it. And they also recommend oral antibiotics to treat the ulcers only in cases of suspected cellulitis, though, as well as suspected osteomyelitis, but they warrant an evaluation for the arterial disease and consideration of IV antibiotics to treat the underlying infections. As well as bacterial colonization and superimposed bacterial infections are common in venous ulcers, which contribute to the poor wound healing. So there's lots of stuff that can be on the table, but overall oral antibiotics are the main ones. And then other medications used to help increase blood flow through the vessels are used along with compression therapy, such as diuretics. They're not commonly used because there's underlying issues that could have caused an edema that would require diuretics. So that's why they're not commonly used. But overall, that first prescription medication was the first one to pop up to help treat CVI because it reduces leg pain.
Question 4. The nurse is teaching a patient about medications used to treat peripheral arterial disease, such as CVI. Which of these would the nurse include in the teaching plan? Select all that may apply. A. Aspirin. B. Cholestyramine. C. Cilostazol. D. Clopidogrel. Or E. Enoxaparin. And I do apologize if I did not pronounce those correctly. Answer and rationale. So the correct answers are A, C, and E. Aspirin is an antiplatelet agent that is used to reduce clotting. C is an antiplatelet agent that is effective in relieving claudication to improve walking ability. And E, enoxaparin, is an anticoagulation agent that is also used to reduce clotting. Medical management of chronic venous insufficiency.
Chronic venous insufficiency can be managed medically utilizing a host of different measures that includes very conservative measures to very complex measures. And as we learned in medical surgical nursing course, that you want to start off with the conservative measures first on a patient. And in chronic venous insufficiency, that would include applying compression stockings, and these stockings are going to mimic the muscle pumps that are defected in chronic venous insufficiency, and they're going to kind of pump that blood and help it go back to the heart where it belongs. Exercise is another conservative measure that you want to teach your patient about that has the chronic venous insufficiency. But then there's also very complex interventions. That includes surgical management of either the repair of the valves within the vein. You can have ablation. You can have like laser treatments to target those varicose veins.
Question 5. The nurse is planning care for an elderly male patient that has been diagnosed with chronic venous insufficiency. She notes that a common, conservative, and effective nursing intervention to start implementing for this patient is A. Schedule an appointment for a vascular surgeon to remove obstruction in lower right limb. B. Apply compression stockings to help manage edema. C. Make an appointment for him to start his first laser treatment of affected veins. Or D. Provide deep lower extremity massages to the affected leg. Answer and rationale. So the correct answer is B, to apply compression stockings to help manage edema. This is the most common treatment for CVI and is the less invasive and most conservative method. So before we wrap this up, here are two diagrams that would go great with your notes. The first one being the venous network of the lower extremities that are commonly affected by CVI. As you can see, they're divided into at least 3 systems, being the superficial veins, the deep veins, and the perforating or communicating veins. And then on the other side, you have a beautiful flow chart of how once the patient shows the signs and symptoms of CVI, how our nursing brains can begin to work and go down the flow chart in order to give satisfactory nursing care. So in summary, the dysfunction of any of the normal venous leg structures may lead to the development of CVI. There is a spectrum of manifestations of CVI with an emphasis on more serious consequences, such as skin changes and venous ulceration. There are several non-invasive and invasive techniques to assist in the diagnosis and management, and the treatment of CVI will be based on the severity of the disease and guided by anatomic and pathophysiologic considerations. Thank you so much for listening. Should you have any other questions, please feel free to ask them on the Canvas discussion board. Have a great day.